right? You go back to there are system structures that were built to solve a purpose, right? And to do whether it's the EMR, whether it's a point solution, whether it is a phone structure or to make a phone call or an outreach. All of these technology advances are right key and critical to actually, make it both the transaction go through, but also to provide a service. But you solve this by going one level up and looking at those connections and establishing what are the commonalities that we're looking for to be able to then translate and ask ourselves, what's the story, right? What are we trying to tell? And what I believe it's when you look at the transaction as a performance and you assume that whatever company, whatever provider, whoever you're interacting with that patient is going, is that their job is to fundamentally do or perform a very strong foundational service. You don't want to go into a mindset of your process is broken. I need to go fix it. What you want to do actually is look at their system and say, I don't need to fix that because your goal is you're serving your patients. What I need to do is understand your behavior. And when I understand your behavior, I will then build a layer to translate that behavior so that we could be able to tell your foundational story. And I think that is where if you were to say something like this 10, 15, 20 years ago, and just go back to life sciences and contracting with patient services companies and hub vendors, right? They built transaction-based architectures to be able to, again, pull through service and prescriptions. Now we have technology that exists that can move a lot faster, that can think, right, that can be able to, with the proper prompting, be able to adjust and adapt and learn. We can take those data architectures and reframe it and continue to let them provide those services. But our then goal is to how do we unearth the story and how do we translate that more strongly and be able to tell it. And I think, right, letting the technology, the providers out there continue to do those and reframe how do we get that data to look more towards what are you doing well and let me pull apart those steps. That I think is where the power lies into more of a foundational structure that is not changing taxing systems, but more actually unearthing and pulling from the value that those systems are doing without disrupting a user's interface or workflow.
That is a very strong point. And the reason I say it's a strong point is because I was interacting with new age entrepreneur in this area pretty much yesterday, who is looking to employ a AI solution at a provider space. And his biggest problem was providers don't want to spend time. I'm like, that's right, because they do not have the incentive to make patient experience priority because they are already so swamped with admin work, with seeing hundreds of patients. They just would not have time to change their behavior. So the trick here, as you said, and you mentioned it absolutely right, the trick really is to understand, to extrapolate their behavior and use that to infer data. Because more often than not, we think everyone is as invested in solving this problem as we are. But I think that's revolutionary reframing of the same problem, that providers being the first touch point for any patient, you're flipping the decision making not on the provider or the patient, but on the integration layer itself. It's incumbent on AI to infer rather than having provider infer it for AI.
And I think when you start to look at then and going to a provider, for example, then once you develop the layer or the prompting or the understanding and you put together the tools to support the insights and it starts to get both, I'm gonna use the term smarter, administrative burden that for example, the administrative burden, you get the opportunity to look at the existing workflow in a different way. And
Mhm.
then you can pull in the point solution or a different opportunity now and enable more time spent either A, focused on patient care, and then you can leverage the layer or the thinking to then solve some of the administrative burden and free up those doctors' time, right? So you're shifting the focus to say what's going on, connecting, thinking, looking at the best attributes, and then you turn the conversation back towards now we can really optimize and what's most important where you're providing value, which is patient care. And let's then leverage AI now that they know how you operate. And now that we know, and now we have a structure to understand that, then the optimization can